Hi, I'm Dr. Sophie Gwinnett. I'm a clinical psychologist and member of the Counselling Directory, and I'm also the founder of Brightside Psychology in the Midlands. So I specialise in helping people with emotional difficulties relating to their physical health and well-being, and today I'm going to talk to you about health anxiety. So health anxiety is when you worry excessively about being ill or getting ill, and it can feel like that worry is taking over your life. For some people, they might imagine the presence of physical symptoms, whilst other people misinterpret existing less serious symptoms or body sensations, but they attribute these to something serious or life-threatening. Sometimes these body sensations might actually be attributable to anxiety itself, such as some tightness in the chest or heart palpitations. But people will continue to worry about these excessively despite having been seen by their doctor and been reassured that it's not life-threatening. When you have health anxiety, your worries and fears may seem irrational to the people around you, but to you they feel very real and they create strong feelings of anxiety and panic. In response to these very overwhelming feelings, you might engage in a number of reassurance-seeking, checking or avoidance behaviours. For example, you may ask loved ones to repeatedly check perceived symptoms for you, or you might make very frequent trips to your doctor. People with health anxiety tend to be very hypervigilant to any small shifts or changes in the body, and you might find yourself engaging in regular checking rituals yourself to look out for or monitor any perceived symptoms. You might also find that you want to avoid situations that can trigger anxiety, such as getting routine investigations or tests done. And whilst all of these symptoms may feel in the short term that they're helping to alleviate the anxiety, actually in the long term they're really unhelpful because they help to maintain the health anxiety. Health anxiety does tend to respond well to psychological therapy. What we do in therapy is we help you to change your relationship with the thoughts that show up, and we help you to get some distance from those thoughts, whilst also changing unhelpful patterns of behaviour that are maintaining the anxiety in the long term. I understand that making that first initial step to seek help can feel hard, but health anxiety is very, very common, and there are a number of techniques that can help you to overcome it. So if you think you might be ready to engage in therapy, or if you'd like to find out more, you can find me and other qualified professionals on the Counselling Directory, or you can find me at www.brightsidepsychology.com, and I offer both online and face-to-face appointments. Thank you.